in a very positive way, hopefully if it's implemented right. And again, operation and research is a very important factor that AI will impact. Always we're worried about challenges, impact, risk, and these things usually delay the implementation. Before starting with this, I would like to share a slide that I just saw a couple of days back. This was the Times magazine. And they say this is the person of the year, the architect of AI. They took over the politician position, they took over everybody, and today is their time. And cumulatively, they're making trillions of dollars out of what they have done. Who's going to be successful, who's going to fail, but today all of them are very successful in terms of making their companies grow. So how did we reach there? I will take you 30 years back. Exactly in November 1995, Internet was introduced in Bahrain. And in November 1995, I did a presentation at the Bahrain Medical Society about Internet and healthcare. Imagine how vague it was talking about Internet at that time. So it's like most of the doctors did not believe me even, because it was something really unbelievable. And that time also the Internet was very slow. There was no mobile, there was all of the things you don't see. But today, Internet became part of our life. Mobiles became part of our lives. Apps became part of our lives. Who discovered the value of Internet at that time became a billionaire. Period. Today, these guys discovered the opportunity of AI. AI did not start today. AI needed the basics. It needed cloud, it needed data, it needed lots of things to happen. So today, we have the basics for AI to happen, and the journey just started for real AI implementation, although AI has started long time back. So, the foundation of AI in healthcare, and this really applies to all implementation of AI. What are we talking about? When we talk about basic definitions, basically, AI will enable computers to understand various sources of data and make them doable by a machine. Machine learning, machines will start learning automatically and learn and learn and learn and will build knowledge as we see it. NLP, natural language processing, is not what Dr. Charles said, you speak to a device and then suddenly it is interpreted and it gets converted into something meaningful. Again, NLP was there a long time back, but today technologies like Copilot and others will do that. Robotics. So many of the discussions, at least today, was talking about software. You know, China is also working more on robotics, and I was in Taiwan, not China, but Taiwan, the neighbors of China. And I visited the hospital in Taipei, Taiwan. Taiwan has a forecast of a shortage of 143,000 nurses in the coming 10 years. They will never have enough nurses. So robotics there was very important. So the demo I saw in the hospital in Taipei was basically a robot which will take all the medications from the store, go to the patient, and the nurse will just administrate the medication to the patient. The nurse does not need to go and run between the bed and a store and check for the medicine. It saved 30% of the nurse's time in that hospital. So that reduces the problem. So software will do it, robotics will do it, machines will do it, hopefully empowering nurses to put their time more on the patient rather than running around trying to get things from the store. So when we talk about algorithms, what we call in Arabic khwarazmiyat, it's the basis of how AI works. You start processing data and make decision making based on applications of rules that you already have. We're trying to create a digital brain. That's what neural networks are. So imagine an electronic brain that starts connecting things, data and information together. Deep learning. So much data is there that we cannot get to. So that's why deep learning, you get all this information and try to make something more useful about it. So this is the basics of AI in a nutshell. These are terms, nothing new. They apply to healthcare and they apply also to non-healthcare. When we go to diagnostics and treatment, we'll see also again revolutions that will enable the AI health worker. So today we already know that in imaging, AI is being used. You can read images, give reports, and assist the radiologist to do more and with reports that are more accurate and less prone to human mistakes. And this is something that we see today happening, and the machines are coming into your hospitals, whether you like it or not. Again, personal treatment planning and predictions, that's also very much doable, that if the right software is implemented, you can adjust the treatment plan based on findings, based on data, and each patient will have his own customized plan. And again, something that you might have heard about, what is called an AI agent. Doctors could have also AI agent with them to help them do their job. The agent could be a clinical pharmacist, an AI agent pharmacist, so prescribing something. The AI agent can advise the doctor that there could be complications, and he does not need to go and research. That the AI agent is again the next revolution in AI. Now, how can we improve the patient care and experience with AI? When internet came in, what was the biggest challenge for doctor? I read this on Google. Google told me this, Google told me that, and the doctors had the challenge of convincing the patient that what he heard or what he read is misleading, and he did not see the whole story. So today, with empowered advisors rather than Google, but with AI-enabled machinery and AI software, they could that could, as the EMT today they mentioned, like remote monitoring of patient at home. This is something now very basic. You see it with an app, with a device, but how integrating this with the healthcare system of the hospital, and goes to the electronic medical record of the hospital, is the next opportunity. Again, you could have, instead of Google, the patient could have enabled by the hospital an AI virtual assistant to the patient that would advise him about his medication, about some symptoms, so there is something immediately at home without the hospital not knowing about what happened to this patient until the next visit, and there could be complications. An example, an automated triage. So somebody coming to ER waiting for his turn in the ER, and he's waiting to be triaged. So if patients come in, get connected to a system, and while he's waiting that triage him, the doctor or the nurses there could be alert that this patient has symptoms of stroke, give him higher priority because of the symptoms that the AI has introduced. So that's also, so what I'm trying to say is that any challenge you see there in the hospital, AI solution like any other system, but this is not only an electronic medical record. This is something that the patient could feel that this kind of implementation have saved my life. Of course, in operation and research, because you have all this data, amount of data now, it's much easier to analyze and much more easier. So you will be able to do AI-driven scheduling, efficient staff management, inventory, things that are very mechanical. And the more these things are automated, the healthcare workers are able to do more with their time rather than dealing with manual scheduling and inventory management. Again, an area that will be strongly impacted is data analytics for public health and epidemiology. Whether tracking disease outbreak, as we've seen in certain diseases that epidemiologists, also supporting healthcare, public health decisions in terms of what are the decisions to handle when it comes to these data. Now, the biggest challenge that everybody's saying, in every technology, is it ethical? Is it secure? Is it safe? There is nothing safe. Whenever you have a tool, there is always a risk. The only way you can do it is take the required, needed steps to avoid these issues. The most critical thing when it comes to patients is data privacy. So, when you implement AI, you have to have a very clear policy. It's the same policy, but it's AI and data privacy. And also how to protect sensitive data without letting not a person use it, but even AI use it and share it outside. Again, is it ethical? Will AI decide based on race, based on color, a decision who takes care? Now, by the way, there are humans who are programming this, so you have to be careful that any system was programmed ethically, so it gives the fair access to healthcare for everybody. Are there any future trends in this? We are already talking about the future. And I don't think there is any boundaries in AI. AI will lead lots, at least in the next 10 years. It will lead many of the changes that we see on the healthcare delivery. And just be vigilant about it. This is the summary of what I was talking about, but I think something that is very crucial for the healthcare workers is training. If you do not train your staff in terms of on AI, the benefits of AI, the risk of AI, it's moving so fast so that learning and training should be part of the core system. We should never forget that if we do not train and develop our teams, we will have a risk of not being able to use the tools or using the tools in the wrong way.